Do you have questions about negative pressure wound therapy or VAC therapy for your loved one who has a wound? I'm Bienstock, and I'm a board-certified plastic and reconstructive surgeon. My specialty is wound care in the home for those that are homebound and or bedbound. Today we're going to talk about negative pressure wound therapy or VAC therapy. So I see a lot of chronic stage 4 pressure ulcers. That means they're really deep. They go down to either muscle or bone, and they're very large and have what we call large dead space or a big open cavity. And it becomes very challenging to heal these. So many of my patients that have these large wounds, I put them with something called negative pressure wound therapy or VAC therapy. What does that mean? In the late 90s, there was a plastic named Louis Argento who invented this system where you're putting basically foam in a wound and you're hooking it up to a system that takes out all the air, takes all the fluid out, and the negative pressure, meaning the sucking motion, kind of like a slurping sound, like a vacuum machine. That negative pressure stimulates new blood vessel growth, takes rid of all the fluid, or we call exudate, as well as releases certain growth factors and removes bad growth factors, which allows the wound to contract and heal. So some of my patients, I use this type of device called VAC therapy, negative pressure wound therapy. The contents, I put a special type of foam inside the wound, and there's a special kind of bridge, meaning like a little arm that has a little tube that goes to a machine that sucks out all the fluid, just like a vacuum machine. And what that does is it removes all the exudate, meaning all that fluid that's being exuded from the wound, which contains bacteria, is coming out. So a lot of the dressing we've been talking about in previous episodes are passive dressing, meaning they just kind of sit there. These are the VAC therapy, negative pressure therapy is active, meaning it's actively sucking out all that fluid. What that does, it removes all of the biofilm where all the bacteria is, takes all that drainage out to help dry the wound. Also, the negative pressure increases what's called the oxygen content, which is a fancy word for, by increased oxygen content, you actually increase new blood vessel growth, which can lead to more nutrients getting to the wound, meaning more beefy tissue, what we call granulation tissue. It also removes bad growth factors as well as induces good growth factors to be produced. And over time, what will happen is the wound should hopefully get smaller by having more tissue grow from the bottom and having the wound contract or grow smaller from a width and length standpoint. So it's affecting both width, length, and height. Now, who are good candidates? Not everyone is a good candidate for this. If I have a wound that's on the sacrum, meaning on the butt, and the patient's having profuse diarrhea, it's very hard to keep a seal. What I mean by that is, in order for this to work, you have to have a tight seal. And basically, it almost has to be perfectly hermetically sealed. There's a trick to do that, but if you're having profuse diarrhea, it becomes very challenging. It also doesn't work very well if the person or patient doesn't have good nutrition, meaning that if they don't have adequate protein in their diet, they're not getting enough vitamin C, selenium, zinc, L-arginine, NAD+, NAC, all the other ones we've talked about. It's going to be very hard to heal even with negative pressure therapy. And obviously the most important thing was always talked about is pressure relief, pressure relief, pressure relief. Meaning if we're not turning the patient aggressively enough, for whatever reason, if they're aspiration risk, meaning they have to be sitting up all the time, it becomes very challenging. So you still have to adhere to the ABCs or the 4 Ps that we've talked about in terms of wound care. Praying, plenty of love by the family, pressure relief, and protein. Otherwise, negative pressure wound therapy work. Now, if you have those in place and there's adequate turning and we have the right mattress for the patient and we're able to have a good seal, we have excellent caregivers and or nurses who are able to continue the dressing. This is something I do with my patients. It's generally changed every other day or 3 times a week. So one of the snafus I deal with is sometimes the nurses don't do it as well as I do or don't do it the way they need to. You have to really take your time. You have to drape out the skin, and I have a whole video of how I do this. I'll put this to the YouTube channel. You have to really be meticulous. Use something called skin prep to dry the skin out. You don't have any moisture. You have to use something called Duoderm on the border to make sure we have a tight seal. You have to really take your time and make sure that there's a good seal. You have to make sure the family's aware of when there's a leak, because if you have this dressing on and there's a leak, meaning that there's not a tight seal, or like in electricity, we want to have a closed circuit. If it's not a closed circuit, that means it's actually not sucking the fluid out, and actually the VAC dressing or this type of negative pressure therapy dressing become deleterious and pernicious, meaning it can actually harm the wound. So the family, the nurses, and the caregivers and all the team have to be aware of this. So everything kind of has to be in alignment. I would say about at least 50 to 60% of my patients are good candidates. Some are not because there's not an adequate caregiver team, there's not adequate nutrition, or we don't have adequate turning of the patient. So a lot of the time I do recommend negative pressure wound therapy. It really is good to jumpstart the wound or actually fill in the deep cavity. I don't use it long term. Some people will have it on 6 months to a year. For me, it's generally anywhere from 6 weeks to 3 months. Generally, I don't need it beyond that. I feel like the wound's generally stagnant after that, and I use other therapies, which we'll talk about in other sessions. If you have any questions or comments about negative pressure therapy and or VAC therapy, please leave them below. Make sure you subscribe to the channel, and please share with all your friends. I look forward to our next session. Thank you so much.